Angelina Jolie opens up about what she's calling her medical choice in this morning's New York Times. She says she made the decision to have that double mastectomy after genetic tests show she had a high probability of developing breast cancer.
She has kept this process very private since early this year, but Jolie says she is now sharing her story in the hopes of helping other women. Let's get right to Dr. Nancy Snyderman, NBC's chief medical editor. Nancy, good morning to you.
Good morning, Savannah. It's estimated that over 450,000 women around the world will die of breast cancer. And the World Health Organization says 200,000 women in the United States will be diagnosed next year. So it's obviously, when we talk about breast cancer, a disease that a lot of us know about, talk about. It's affected our brothers, our sisters, sometimes our brothers, our mothers. And in Angelina Jolie's case, she wants us to know that it can also be a personal journey that weaves, in her case, her family history and her genetics. And she wants women to know about the options.
In an op-ed in this morning's New York Times, actress Angelina Jolie writes that she chose to have a double mastectomy to reduce her chance of getting breast cancer. The 37-year-old Oscar-winning actress made the decision after losing her own mother, Marceline Bertrand, to ovarian cancer in 2007. Shortly afterward, Jolie talked to Ann Curry about the loss.
It's a natural thing for a child to lose a parent. I lost my mom too young, but it happened, and I'm happy she's out of pain.
Jolie underwent genetic testing for a mutation in the BRCA1 gene, which sharply increases her chances of developing cancer. Doctors estimated the actress had an 87% risk of getting breast cancer and a 50% risk of ovarian. In the editorial, Jolie writes, "Once I knew this was my reality, I decided to be proactive and to minimize the risk as much as I could."
This is a very unique situation in that she tested positive for a specific gene mutation, and in women who do test positive for these mutations, we will more often recommend prophylactic surgery.
Jolie says she began with a series of surgical procedures on February 2nd to remove the breast tissue, ending with reconstruction of both breasts using implants. The entire process took about 3 months. Jolie writes, "I did not feel any less of a woman. I feel empowered that I made a strong choice that in no way diminishes my femininity."
I can't imagine that this would have any sort of negative impact on her image or her ability to get work or to do any of the roles that she's done in the past.
And by her side the entire time was her partner and the father of her 6 children, Brad Pitt. About Pitt's support, Jolie writes, "Brad was at the Pink Lotus Breast Center where I was treated for every minute of the surgeries. We managed to find moments to laugh together. We knew this was the right thing to do for our family and that it would bring us closer, and it has."
Most cases of breast cancer are random. Genetic mutations only make up 5 to 8% of all cases of breast cancer. But in this particular case, a specific bad mutation of the BRCA1 gene, in this case for Angelina Jolie, combined with a very strong family history, meant that she had the time to sit down with genetic counselors and determine what was particular in her case and what was her best option. I think, Savannah, in this case, it is the epitome of personalized medicine.
And let's put this in perspective, Nancy, because I think you just said it's really about 5 to 8% of the population that may have this gene. But a lot of people watching might think, should I get this testing? And is it practical for them to do so? Because as I understand it, it's quite expensive.
It's exactly what I want women to hear, that this is not a random test. Because her mother was diagnosed with ovarian cancer at a very young age, and because she had the means to get this test, which can be $3,000, and then have the right doctors to sit down and counsel her, she could make an informed decision. Ironically, I'm at a conference in California today on just this kind of thing, understanding your genome. And while we start to understand more and more about the genetics of cancer, we're going to be able to tailor screening and then treatment. But right now, it is not for everybody. So if you are an of Ashkenazi Jewish descent, if you have a strong family history, breast, colon, pancreatic, ovarian, or cervical cancer, on either side of the family, sit down with your doctor and decide, is this for you? In some cases, insurance companies will pay for this. But then also be prepared. What are you going to do with the information if you get a positive test? It's not just BRCA1 or 2. It's an abnormality in those genes that makes people have to be concerned in some cases.
Well, it's a courageous decision, and she certainly started a conversation. Dr. Nancy Snyderman,
yes, she has.
Thank you so much.